So my case is talking about a 16-year-old patient who was suffering for the last years from severe headaches. 1 month ago, he developed acute numbness and weakness of his right lower limb, accompanied by disturbance of speech, and the symptoms have passed after 5 minutes. 2 weeks later, he had a similar incident involving the other side of the body. Subsequently, the patient undergone MRI. Here you can see the T2 weighted images. You can see cortical hyperintensity and subcortical in the right temporal lobe. On the next slide, I enlarged one of the T2 weighted images in the area of the basal cisterns. You could see some other findings which could direct you to the diagnosis. We'll talk about them later. Here on this slide, you can see on the top left side the T2 weighted image and 2 FLAIR images. You can see longitudinal hyperintensity in the white matter. So the next question will be about what do these white matter hyperintensities what do they represent on the T2 and FLAIR images? So the first option is the Burko-Robin perivascular spaces. Second option is the lacunar infarct. Third option is collateral blood vessels, or POTE of demyelination. Okay. So the right answer is collateral blood vessels. Subsequently, the patient. Okay. First, I'll show you a few pictures of T1 weighted images after gadolinium injection. You can see the enhancement of those blood vessels we saw on the T2 and FLAIR images. And in the lower part, we can see SWI and diffusion weighted images, which look fine. You didn't see any pathological findings on them. The next exam that was done was the digital substructive angiography. Contrast was injected through different blood vessels in the neck. You can see all of them. I have several two videos. One of them. Here the contrast is injected through the right internal carotid artery. On the other video, you could see contrast injection through the right external carotid artery. Okay, no. So what do you think is the diagnosis? The first option is tumor blush. Second option is arteriovenous malformation. Third option is Moyamoya disease. And the fourth option is vasculitis with formation of microaneurysms. So you were right. The next question will be about Moyamoya disease. What is the clinical presentation which occur predominantly in adults with Moyamoya disease in comparison to children? The first option is ischemic stroke. Second option is cerebral hemorrhage. Third option is seizures. And the last option is transient ischemic attack. The answer is cerebral hemorrhages. Adults usually present with cerebral hemorrhages. So Moyamoya disease is a progressive idiopathic narrowing of the supraclinoid, the distal internal carotid arteries in most of the cases, and in some cases we could see a narrowing of other proximal arteries of the circle of Willis, and later formation of secondary collateral vessels. And in the advanced stages we could also see PL collateral vessels. In around 25% there is the disease affect also the posterior circulation. It has bimodal age distribution in around 6-year-old and 35-year-old. The incidence is, the disease is rare, but the incidence in Japan is 10 times more higher than in the Western countries. And there is some familial association. The main clinical presentation is different between children and adults. Children present usually with transient ischemic attacks, alternating hemiplegia, headaches. Long-standing disease can cause cerebral atrophy with subsequent mental retardation. Adults are usually present with hemorrhages due to formation of microaneurysms in the collateral vessels. The hemorrhages are usually around the ventricles or in the area of the basal ganglia. They also could present with transient ischemic attacks and infarcts, multiple small infarcts in the watershed areas. The main exams that we do to diagnose the Moyamoya are MRI and angiography, digital subtractive angiography. On digital subtractive angiography, we could see the narrowing of the supraclinoid internal carotid arteries, or in some cases other proximal circle of Willis vessels, formation of cloud-like collateral vessels, which have appearance of a puff of smoke, hence the name Moyamoya, which means in Japanese puff of smoke. And in later stages we could see also extensive external carotid artery PL collaterals. On the lower pictures you could see digital subtractive angiography. On the left side, left carotid artery was injected with contrast, and you could see these multiple collateral vessels, which are also called the Moyamoya vessels. On the right, on the middle, you can see DSA with injection through the external carotid artery, in which you can see prominent external carotid artery vessels, and on the right side you could also see the less common case in which the PCA, the posterior cerebral circulation, is affected, the PCA stenosis. On MRI, we could see on the T1 and T2 weighted images multiple dot-like flowoids in the area of the basal ganglia and around the ventricles. On FLAIR, we can see the leptomeningeal ivy sign, it's a bright sulci. It's slow flowing gorge PL vessels. On T1 weighted images, after gadolinium injection, we could see the enhancement of those collateral vessels in the area of the basal ganglia and in the cisterns. On MRA, we could see the narrowing of distal internal carotid arteries and proximal carotid artery circle of Willis vessels. Diffusion weighted image is usually used to differentiate acute from chronic strokes, and gradient echo to look for microbleeds. On the lower portion of the slide, you can see on the left side T1 weighted image with small black dots is the flowoids in the area of the basal ganglia. On FLAIR, you can see IV sign, the enhancement the bright sulci, and we could see the T1 weighted image after the linear enhancement, also with enhancement of the sulci. On the right side, there is an MRI image with multiple collaterals and PO collaterals. Differentiate diagnosis, the large vessel inflammatory vasculitis, all the subtypes, in which we could see vascular stenosis, usually in the more distal areas of the vessels. A tumor blush, like you can see in the third image from left, in case of meningioma. IV sign could be seen in Sturge-Weber syndrome, leptomeningeal metastasis, meningitis, and subarachnoid hemorrhage. Another entity is the Moyamoya syndrome, which is usually secondary to other diseases. You can see in this slide. And,
please conclude.
And the main treatment is bypass surgery in children. We use the indirect bypass surgery, in which scalp vessel is placed on the surface of the brain, and the collateral vessels are formed later. And in adults, we use the direct bypass surgery, in which we connect between the external carotid artery and the internal carotid artery. So back to our patient. You saw the findings. He underwent surgery with the superficial temporal artery to middle cerebral artery bypass, and the rest of the post-operative period was unremarkable.